Good morning. I'm Robert Jansen. I'm Chief Medical Officer at Grady Health System. This morning I was walking into work and I ran into one of my colleagues who's an emergency medicine physician. He had just finished his night shift. So I asked him how it was. And the story is so horrific. Our emergency room, like so many, are overrun right now. We have more patients in the emergency department waiting for care than at almost any other time. And this is seen at every hospital in the city and across the state. I know we're talking about COVID. So what is the COVID impact on this serious issue with emergency departments? Our emergency department, as you know, is the major trauma center. We're a major burn center and a major stroke center. Those patients don't stop coming in. They still come. Those patients who have been delaying care because of COVID are still coming in. Those patients with all the medical conditions that we see day in and day out. Diabetes not controlled, heart failure, chronic lung disease, sickle cell anemia. Those patients are still coming. Now we have the Delta wave, which is how I've come to think of it. This tsunami of patients coming to the emergency department who were infected with the Delta variant, layered upon already an incredibly busy emergency department. The result is that patients are waiting longer. They spend more time in the waiting room if they're not critically ill. And the result is that some patients who require admission spend time waiting for a bed upstairs in the emergency department because our beds are full. Our beds are full with those patients who normally come to Grady, and they are full now with COVID patients. We talk a lot about diversion and what that means to the community. So diversion is a term that we really use to communicate with EMS, giving them the status of our hospital. For the first time that I can remember, we are having to go on diversion not because of trauma cases, but because our emergency department is full with patients who were infected with COVID. Now, let me clear up a myth. Diversion doesn't mean you can't come. If you come to any hospital who is on diversion, you will still be seen and you will still be receiving the greatest care you can receive. But it's our way of communicating to the ambulances that we're full, and if you can find another place to go that can deliver care quicker, that would be a better option. But we never turn anyone down. We never turn a trauma patient down, a stroke patient down, a burn patient down, or anyone else who requires care. But the impact of COVID on those patients who need our care is significant. And as you've already heard, who are these patients who have COVID? They are primarily unvaccinated patients. They are people who have chosen, for whatever reason, to not get a vaccine that we all know is safe and effective. Our hospital is filling up with COVID patients, and they are not vaccinated. Very few patients who are vaccinated have required admission at our hospital or across any of these facilities. So what can we do? What can we do to make sure if you need emergency care, it's available? Get vaccinated. Take care of yourself. Do the things that we know help prevent the spread of this infection. It's the only way we can succeed, and we can do that. But it takes work, it takes effort, and it takes all of us to do that. This is real, and it is having an incredible impact on our community and those people who still need care who are not infected. Thank you.